IFEANYI. He is the National Publicity Secretary Association of Medical Laboratory Scientists of Nigeria. Good morning, sir.
Yeah, good morning, Cynthia.
All right, it is not news that the Joint Health Sector Union has commenced strike as a result of failure of the federal government to implement agreements signed with the union. The strike by the health practitioners has brought untold hardship on Nigerians, especially the poor ones. So today we'll be discussing factors that has led to the incessant strikes by health workers and also solutions to stop the occurrence of this strike. All right, so first of all, let us start with what are the causes, what are the reasons for these several strikes action that we've been having facing the health sector?
Well, one, I will tell you at the root of the and it was ceded to them, and ever since that happened, the health system hadn't known peace, and the health system had become very disastrous in terms of access to care, in terms of quality of care, in terms of administrative and managerial challenges. You see, when you take a novice, you are a novice in any field that you are not trained, you have not received training. If you have not received training in human resource management, if you hold a PhD and even if you are a professor of physics, you are a novice in human resources. And so that's the challenge we have in the health sector. We have people who are trained to care for the sick, now usurping the position of leadership, usurping the administrative role, usurping managerial role. They have no training in this area. And so before now, the Nigerian healthcare system had been very effective and efficient before the 1985 decree. And so what was the magic one then? We had people roundedly trained for administering healthcare. People we knew then and still know today as hospital secretary, hospital administrators, and that is the Indian across the globe, particularly in developed nations. If we are striving to become like them, we must do things right. When the British left, they did not leave us a system that were administered by clinicians. They left us a healthcare system that were administered by trained health hospital administrators. Now I'll submit to something. 2 days, on Thursday last week, I watched Dr. Sahoe Nabulele, the ex-trial NMA chairman, say something, and I laughed. Did you know what he said? He said that the only time the Nigerian health system worked was when Professor Ita Olambo was the Minister of Health. You can go look for a clip and watch it. He said that was when the primary healthcare systems worked, the tertiary health systems were revamped because of the environment intervention and several other interventions that Professor Ita Olambo, who is not an MBBS degree holder, he is a trained health economist. And so that underscores my submission that the problem we have in the health sector, until we remove doctors from running hospitals, the hospital system in Nigeria will remain comatose, will continue to occupy the ignoble position of 48, 49, and 50 out of the 52 countries in the world when ranked in healthcare service provision. And now, who are those destroying the health system? There are groups that are cut out because of peculiarity, because of their arrogant ignorance and hegemony. They want to destroy the health system. Who are they? The Nigerian Medical Association, the Medical and Dental Consultants of Nigeria, the National Association of Resident Doctors. I tell you, so beautiful. I like this question. Now, and let me give you the next person. Their captain is usually the Minister of Health, who by default in Nigeria has been made to be exclusively a preserved position for doctors. In the UK, since I was born until now, the health secretary hasn't been a doctor. Check how old I will be. Guess how old I will be. In the US, the same thing. Now, before Obama, when Obama became president, the wife had to leave her job as a hospital administrator in the US. So I have given this because very many times Nigerians will hear NMA and MD can say in global best practices. I have mentioned, I do not know any, I'm sure for Nigeria, Britain is now the gold standard because our president and his son goes there as if they're going to drink water for healthcare service. What I said is, when this we should actually start for a minister to lie to the entire populace, for a minister to have misled government is enough that the word honorable should be taken out from his designation and he should show the way out. How did I mean? September 2017, 30th September to be precise, government, ably represented by the Minister of Health, Professor Adewale, Dr. Chris Ngige, the Minister of Labour, signed a settlement memorandum of agreement on very many points with the Joint Health Sector Union. Had a 5 weeks timeline for implementation. We are on the 7th month or thereabout. And government has reneged on those agreements. And to make matters worse, Isaac Adewale, the Honorable Minister of Health, came on air and told Nigerians lies that they had no agreement with the host. We were now compelled to go and place it on an advertorial. If you look up the Nation's newspaper of last week, pages 44 and 45, we had to place the advertorial there Wednesday last week. Now, so you see what I mean. So since the commencement of this strike, he's been stoking and inciting the populace and making matters worse. He incited the CMVs and MDs of federal medical centers and teaching hospitals to implement the no work, no pay rule. NMA, NAD had held this country to ransom with strikes severally. At no time have this aspect of the law been invoked because they are interested at conflict of interest. He incited them that they should open attendance register. For goodness sake, you can visit any of our hospitals even now that we're on strike. No doctor signs attendance in any Nigerian hospital. So why must you now apply it to the other people? Because they are on strike. Besides, we are talking about no work, no pay rule. For a group that worked for 19 days in a month before and had followed all the due process for calling out members for strike, I think it is ignorance on their part. He doesn't even know that the Federal Minister of Health lack the capacity. They do not have the authority. They are not the relevant institution to invoke the no work, no pay rule. So it shows the level of ignorance. And they exude it with arrogance. Now, let's move on. The ex-wife, because if I had an election, the ex-wife president of NMA, Dr. Michael Grima, at the commencement of the strike, went on air and told Nigerians that the only 5 registered trade union in the health sector is illegal. Because he's the leader of NMA, which is a mere professional association, and do not have local standard to call out members for strike. And they have done that with impunity in Nigeria. And the government will always concede to their demand. Now, it is only in Nigeria, across the entire globe, that you find students go on strike and hold government to ransom and government meets their demand. Now, that is the Association of Resident Doctors in Nigeria. Do you find a similar situation in UK? In fact, it is only in Nigeria that people do residency and government pays. That is an aberration. And now if you're going to do that, this table we're looking at is either on 2 or 4 legs. Every table will either be on a tripod or a 4-leg. And so if you want to raise the height of this table, which is akin to raising standard, if you continue to raise 1 leg, what will happen? This table will become unstable. It will topple. That is what is happening in the health sector. We have a residency program that once you finish your MBBS degree, you proceed to the residency program and you are appointed consultant thereafter. And of course, that is a license not to work anymore. You are appointed consultant and patients can now see you probably twice in a month. In a year. So you find out that the other people, in every healthcare system, there are what we consider as core service providers. Core. The nursing service is a core service. The medical laboratory is a core service. The pharmacy is a core service. And a lot more other. If you therefore decide to raise the stand of the clinical service, you will have an unstable system. And that is what has happened in the Nigerian healthcare system. Now, you know why I laugh at MD when they blab and deceive Nigerians? I want them to show us, let them make public to Nigerians, an approved scheme that takes them to consultant, as approved by the National Council on Establishment. No such document exists. Now, the document that was issued during the military era at about 1976 provided for the appointment of medical and non-medical consultants. Today, the medical and dental consultants of Nigeria continue to blab, mislead and misinform Nigeria and create chaos in the health sector, because in Igbo parlance they say, Aladima Urunize. That is to say, when there's confusion, that is when the chiefs profit. When there's strike, when there's crisis in the health sector, they make you believe that the public health system has failed. Come to my private hospital. Do you see the antics of the medical and dental consultants of Nigeria? They are ripping Nigerians off and destroying the public health system. So that's the problem we have in the health system. And for us to hear people like Ogrima, who is supposed to be an orthopedic surgeon, I want to challenge him. In the last 2 years, how many patients has he attended to as NMA president? He's been gallivanting. And he comes to tell Nigerians that they should disregard Jehosu. That is amazing. You should disregard over 75% of the health sector workforce. It's laughable. Very laughable. Now, I am happy the NMA have had a fresh election. And one Dr. Francis Adebayo had come on board. Well, he said this morning in Vanguard newspaper that government should concede to the demands of Jehosu. But then, you see, that is for me the devil's apple. That utterance is the devil's apple because he said he disparaged the strike. Now, do you know the meaning of the word disparage? That means that the strike is meaningless. The people on strike are not important. Of little worth. He deprecates the joint sector, health sector union. You see, the other thing I want to let the public know is this. The Honorable Minister of Health said something that I laughed. He said, nowhere in the world are other health care workers paid the same thing with doctors. I do not want to be paid the same thing with doctors. Do you know why? I do more job than the doctor. And so I should be paid more. Across the globe, remuneration is premised on job evaluation, on the value you add, on services rendered, not for the designation or title or the toga you bear. So nobody in Jehosu wants to be paid the same thing with doctors. We should be paid for what we do. We should be paid for the job we do. We should be paid for the value we add. We should be paid because we are indispensable. We are now on strike in the tertiary hospitals. It is completely closed. I gave a narrative last time on this on a related platform of how National Hospital Abuja were turning people back. These are the same people that told the world no, that everything is in order, they should come. I gave a narrative also the other day how a patient fell off a multi-level ward in the UCH Ibadan, at UCH Ibadan, because the people that would attend to him, people that would care, are not on duty. In fact, those who provide healthcare services are on strike. And Nigerians should be aware. Do not go to tertiary health institutions until the strike is over. You will be doing that at your own peril. That is the truth. Because we have had experiences of it in the past, even in the current strike. In the current strike from Federal Medical Center, because the MD was under pressure to now do what he called outsourcing, to do task shifting, to create local job, he brought charlatans, and they were issuing people bizarre chemical pathology results. And the consequence of that is very calculable, and can lead, of course, would have led to several deaths. Some other time again in FCT Abuja here, a Federal Medical Center did the same thing, brought charlatans, and they were issuing people HIV positive results that were not negative. I mean, negative persons, they were issuing them HIV positive results. So for us, the truth is this. We're not asking to be paid equal with doctors. Nobody wants to ask that. We're asking that government should pay us for what we do, for the value we add, for the services we render, for the risk we take to provide service. Do you know what it takes for a nurse to sit in a psychiatric ward? Do you know what it takes for a nurse to sit in an open ward where we have patients with diverse kinds of infirmity and expose themselves sedentarily because they sit? Over time, most public hospitals do a shift of over 8 hours. Can you sit here for 8 hours uninterrupted? That is what nurses do. In fact, most private hospitals, nurses do 2 shifts, some double shift. So 12 hours, 24 hours, sitting in one place, exposed to all manner of diseases. And you're talking about the person receiving the same thing with the doctor who merely clerks you and walks away. We're asking to be paid. In fact, the Nigerian government has introduced injustice in the health sector. What is the injustice? When you heap everything on one person and deny the other person, that is injustice. And anywhere there's injustice, you will not have peace.
Okay. All right. At this point, we'll go on a very, very quick break. We have been speaking to Dr. CASMIR IFEANYI. And of course, there are a whole lot of questions to be asked, a whole lot of things to be said. But after the break, just stay tuned. The program is still Issues of the Moment.
For almost a decade, the Nigerian army have given their all to ensure that our dear country is not overrun by Boko Haram insurgents. Some have in the process paid the ultimate price, while many will forever live with indelible scars occasioned by their determination to protect the country, no matter the hurdle. Despite these, they have remained resolute and undaunted, and today, all territories the insurgents once took control of have been recaptured and normalcy restored. And now, for the first time in a long time, the end of Boko Haram is foreseeable. Therefore, the wisest thing for the remaining insurgents to do is to surrender today or face total destruction from the army. Remember, the Nigerian army will stop at nothing to ensure that total peace is restored in all parts of the country. So, be wise and embrace peace today or get ready to be ruthlessly dealt with. This message is brought to you by the Coalition on Conflict Resolution and Human Rights in Nigeria.
All right, welcome back. If you're just joining us, well, you have missed a whole lot. But we still have Dr. CASMIR IFEANYI, who is the National Publicity Secretary, Association of Medical Laboratory Scientists of Nigeria. And we are looking at the unending strikes and, of course, in the health sector. And we're talking about what is responsible for this. Let's move on. Let's talk about, in spite of, we have we have a whole lot of government hospitals. There are not equipment in this place. And of course, we have this allowances always removed from civil servants, medical allowances, but yet they still go to the hospital and they still pay. What is the cause of this? Why is it like that?
Now, that is because of inadequate funding of the health sector in Nigeria. Of course, several regional and global bodies had prescribed 15% of the annual budget to be reserved for funding healthcare service. I can tell you, since the return of democracy, we've not exceeded 5%. Even this 2018 budget will not exceed 5%. But the good news, and sharing in that sense, is that an aspect of the National Health Act signed by President Goodluck Jonathan in 2015. The Senate President, Dr. Bukola Saraki, has promised he is going to ensure the implementation of a 1% funding for health from consolidated account. Now, if that happens, it will free a lot of resources for funding, particularly the primary healthcare system in Nigeria. But the worry I have with that is that that same law talked about minimum package, minimum health package. It is that minimum health package. A fraction of the 1% will go to it. A fraction of that 1% will also go to providing equipment, all right, and consumables. Now, the minimum health package is being reviewed as we speak by the National Primary Healthcare Development Agency. Unfortunately, you see, when I talk about the reasons for the president to have eased off the Minister of Health, people think it is malicious. Now, we engaged the minister and said, Honorable Minister, you promised Nigerians that you are going to establish one primary health care center award. That's being my ambition. He said no, they will do it. As we speak today, they've not lifted a finger on that promise. Now, look at the pomp and pageantry with which they commissioned the one they were supported. They had international support for at Kuchingoro. Wonderful as that Kuchingoro primary health care system is, why he had received patronage is because it has laboratory component. All right? It even has one of the best facilities for diagnosis of tuberculosis, Gene Expert, donated by USAID. Now, the same minister in a meeting with us told us that the primary health care centers they are going to establish will not have medical laboratories attached to it. So any healthcare facility without a laboratory component is mere soothsaying. In fact, it is witchcraft. I tell you. At this, look at the bring in the health sector had led to several litigation. Now, and there are several court judgments in the favor of the litigants against the Federal Ministry of Health and their institutions. Kindly implement these rulings. Do you know what the Minister of Health, as Professor Adebola told us? He said, you have the law. That is the status of the country in your favor. You have the ruling of the courts in your favor. But you do not have political power. And so long as you do not have political power, you must come and beg us. And you will not get what you are looking for. He said that much in his office on a courtesy visit. And so, how on earth would you have such a person sit as Minister of Health and expect the health system to work? Now, these are the issues, and I have to bring them forward because people will think it's malicious. It is in the interest of the people. We're asking for incorporation of laboratory components in all the PHCs to serve the people. It's part of the demand we're making. Now, we're asking that you see, it is not for the Minister of Health. It is not for Professor Michael Grima or Dr. Francis Adebayo or the chairman, Dr. Mbibi, the president of MDCAN, to dictate the health system. The duty of the minister is to coordinate the system, following status and extant government circulars and policies, and not arrogate to himself the know-it-all disposition of it is either you conform with what I want or you get nothing and the system will be frustrated. Our worry is that in Nigeria, people now have impunity as the order of the day, and our president is yet to call them to order, particularly his appointees. In the health sector, the Minister of Health should go. I tell you something again that is worrisome. The ministry and their minister do not believe that the legislature has a role to play in governance. They take it out on them, abuse the legislative processes and legislative work. For example, can you imagine the minister's representative saying that Act Cap M25, LFN 2004, laws of the Federation was gotten from the back door?
Almost have fronted that statement.
I do not know. I do not know. Can you imagine what I just told you? For the Minister of Health to say that no, though you have court rulings in your favor, National Industrial Court rulings and Court of Appeal rulings in your favor, so long as I have political power, you will not have it implemented. That's impunity. That is flagrant abuse of the rule of law. And these are the things causing trouble in the health sector. Now, I talked about the issue of consultant. As we speak today, MD want Nigerians to believe that no other person in the health system in Nigeria today is a consultant other than an MBBS holder. That is a big lie. As we speak now, we have our colleagues who were appointed consultant on the basis of extant government circular for that level of appointment in Ahmadu Bello Teaching Hospital. We have our colleagues who are consultants, honorary consultants, in the University College Hospital Ibadan, UCH Ibadan. We have our colleagues who are consultants in University of Calabar Teaching Hospital and many other places, including the Aminu Kano Teaching Hospital, Kano. And so, for them to continue to mislead Nigerians that any day, any other healthcare professional is called a consultant, there will be chaos in the health system. People will start to die. People, they are just issuing threats and instilling fear in people, is a big lie. It has been the practice. It is not new. What they want to do is to stifle that appointment the way they surreptitiously chased away hospital administrators and hospital secretaries from the healthcare system, so they can have a field day and terrorize Nigeria and fleece them.
Do you think that it is time or is long overdue for them to call the state of emergency in the health sector? You
see, the truth is that there's want of political will on the part of government to do the needful. Our president, President Muhammad Buhari, the people's president, by the reason of his stay in hospitals in UK, I'm sure he would have understood how the systems work there. So why wouldn't he adopt the UK template and salvage the health system? Now, in the UK place, we have Nigerians. Dr. Otman Adeshina is a Nigerian, a Yoruba man. He's a consultant biomedical scientist, which is medical laboratory scientist, hemostasis, in the Cambridge Hospital. And many other of our colleagues that are Nigerians and British citizens alike, who are consultants, biomedical scientists in cervical screening and other subspecialties in the medical laboratory science profession. Not to talk about consultant nurse. Since 2005 in the UK, they introduced what they call Agenda for Change. The Agenda for Change provided the platform for the revolution that are taking place in the national health system in the UK. And for us to have respite in Nigeria, it is important that government muster the requisite political will and repeal and therefore amend the obnoxious decree of 1985. That amendment will pave way for peace. That amendment will pave way for the needed reform in the health sector. That is what is missing. Until that is done, every other thing is cosmetic. It's like embalmment. There's nothing you know how. There's no way you embalm a dead person and it comes alive. That cannot happen. Now, government successively had set up committees. We had the Justice Guzo-led Committee for Harmonious Work Relationship in the Health Sector. After that, every other healthcare professional group in Nigeria signed and accepted the recommendations of that committee. The know-it-all people, the do-it-all people, the Nigerian Medical Association reneged and rejected the report. So if you have an exam and you have 8/10 or 9/10, as was even the case, well, it should have passed. But for want of political will, it was confined to the dustbin of the archives. Now, thereafter, government again, to meet their aspiration, set up another panel led by Yayale Ame, a revered public servant. Yayale Ame committee did a very thorough work because they had some reputable Nigerians with integrity as members, including our colleagues. Unfortunately, the report was bungled and turned in favor of, we now have 1/9. The other time we had 9/10. So we now have 1/10. And that one that will have 1/10, which met the aspiration of only one professional group in the health sector, is the one that they are happening every day that government should implement. That's another recipe, and we're waiting. But I am sure this government is wiser than that. They will not be led to the crucible, which will follow the implementation of that boggled report. The other health professionals have condemned the report in its entirety for not meeting the implied need, or not meeting, not sufficient, for not being sufficient a panacea to the crisis in the health sector. See, you cannot get all and get to the zenith of your career, and you insist that some other person will not grow. That is the situation in the health sector. I have said in the early 70s, to the early 80s, if you graduated as a pharmacist, 5 years training, 1 year internship, 6 years. You graduate as a doctor, 6 years training, 1 year housemanship. So it is 6 to 7. Now, that is where the word parity that they are banditing about came from. Okay. So, government, therefore, said everybody enters on GL8. That was between the early 70s to the early 80s. So, you will always see the trouble, the curtailed cost in the health sector. Now, everybody entered on GL8. Okay. Doctors entered on GL8 step 3. Pharmacists entered on GL8 step 2. The parity then was on step, and the import of step in public service is 1 year. It is every year you get an increment of 1 step, not a grade level. Today, you graduate as a pharmacist, your parents will regret training you. You graduate as a med lab scientist, your parents will regret training you if they have your sibling who reads medicine. Because he will leave school with you probably the same year. He starts work on grade level 12. And thereafter schemes another grade level to 14. Do you appreciate what I'm saying now? Whereas you will start on 9. Okay. For a difference of 1 year. Meanwhile, if you put the salary of a pharmacist times 2, it is less than what one fresh doctor would take in 1 month. So where is the hazard? I sit in the lab, you bring me human feces. I sit in the lab, you bring me sputter. I sit in the lab, I manipulate blood of all kinds of people with different kinds of diseases. I sit in the lab, I do all sorts. I play with human skin, human tissue. I do all that. And you know the hazard I take in a month? 333 naira. If I tell you the hazard a doctor gets for just sitting and clacking you, it will pay my salary. It's amazing. That's where we are. Nigerians must be told this. And why are we insisting on things like the appointment of consultants? Why are we insisting on the abrogation of things like, do you know in the hospital today, we have deputy CMAC mechanic. Deputy CMAC maintenance. So doctor is now in charge of those who service vehicles in the hospital. Deputy CMAC.
All
Deputy
right.
CMAC security.
All right, so
Jesus Christ.
we'll have to round up at this point.
So Nigerians must be told how these people have frittered on our patrimony and destroyed institutions that are supposed to take care of us when we're infirm and frail.
All right, thank you so much, Dr. CASMIR IFEANYI, who is the National Publicity Secretary, Association of Medical Laboratory Scientists of Nigeria. I know that there are a whole lot of things, a whole lot of decay that that definitely Nigerians ought to know about. But definitely, maybe we'll have another time to discuss some of these things in more and more on the show. The program is Issues of the Moment. We have been talking about the unending strikes and looking at the strikes in the health sector. My name is Cynthia Agbor. In everything you do, don't forget to invite your friends to like our Facebook page, Television Nigeria. Follow us on, subscribe to our YouTube channel, Television Nigeria, on Instagram, and of course Twitter is RTV Nigeria. And in everything you do, be good to yourself and stay healthy.